Well, July is National Minority Health Awareness Month, and while it may be the end of the month, it's so important to acknowledge the issues impacting parts of our community. According to the American Psychiatric Association, people from racial and ethnic minority groups are less likely to receive mental health care. Some of the barriers to receiving that care include lack of insurance or underinsurance, lack of diversity amongst healthcare providers, the stigma surrounding mental illness, and in some cases, also language barriers. Here to talk about some of those important issues and ways to get help locally is mental health mentor Andrea Rogers with Hagira Health. Andrea, good morning. Thanks for joining us.
Good morning. Thank you for having me.
Of course. So let's jump right in here. When it comes to mental health amongst people of color, why do you think there are less resources available?
You know, the reasons that you stated are so true. There's cultural stigma, there's things such as medical mistrust. But I really believe the advocate for Minority Mental Health Month really puts it best. She said, B.B. Moore Campbell says that in a race conscious society, people of color are just less likely to want to be seen with just one more deficit. And I think that's a really big part of it.
And I think we've seen these challenges play out so much recently, too, with the COVID-19 pandemic. What is Hagira doing to support these communities and try to combat this challenge?
You know, Hagira has some mandatory trainings that we can be more culturally aware and provide effective care for communities of color, such as implicit bias training, interventions that are more likely to be effective in communities of color with evidence-based care. And also having a culturally diverse staff is a huge step in providing care for the community.
Andrea, on an individual level, what are the predominant issues that you and your colleagues are seeing right now?
You know, we have this perfect storm of stressors that is going on in the world right now. You mentioned COVID-19, social justice issues, while definitely not new, they are definitely on the rise with different issues that are being shared in the media. And there's so much going on just in life in general for people of color that the additional stress and the lack of effective care just provides more issues for mental health symptoms.
There's often a stigma when it comes to mental health in communities of color, some of which involves the perception even of mental illness. Can you kind of put that into context for us and help us understand that?
You know, there is a very real fear of labeling and mislabeling, often with communities of color, because that training or that care isn't there. They're more likely to be misdiagnosed and to have their pain not actually acknowledged. So they feel when they go to get help, they don't receive the help that they need.
And I would imagine with that mistrust, it can become really intimidating or in some cases even fearful to take that step, to go see that specialist.
Absolutely. And even it could be, you know, unfortunate for them, it could hinder and not help the process.
Right. You know, they say it takes a village. So what are some signs that people in the community should be on the lookout for if something's going on with their loved one? What are tips for friends, family members watching this right now who know that this is a problem they experience?
You know, it's so unique where it's different with everyone, but you really want to look for changes in behavior or the everyday routine. Some people, it's getting less rest. Some people, it's getting more rest. When you look at changes in mood, especially with the stress factors that are present, the responses that family members give you, or just something different, you feel them drifting away or you haven't talked to them in a while, and that's not normal for that particular relationship. It's okay to just reach out and just ask, is everything okay? Is any assistance needed? And normalizing therapy, not just encouraging others to go to therapy, but going to therapy ourselves and normalizing that in the conversation. I talked to my therapist about this today, and that makes others more comfortable as well.
Absolutely, yeah. Normalizing seeking help and getting help and making that a positive thing and not something to be ashamed of. You know, before we let you go, Andrea, where can people go to seek help or to get more information?
Sure, we can be reached on our website, hagirahealth.org. That's www.hagirahealth.org.
Andrea Rogers of Hagira Health, thank you so much for taking the time to speak with us about this very important issue and the resources and help that are available right here in Metro Detroit. We appreciate your time.
Thank you.